Thank you for joining me today. In this video, we are going to learn more about psychopharmacology. Psychopharmacology is very important, and we are going to overview that in this video. So first session of the psychopharmacology include antidepressant medication, SSRIs. SSRIs are selective. SSRIs selectively block serotonin transport. They prevent reuptake of a serotonin back into presynaptic neurons. This increases serotonin availability in the synaptic cleft, especially in a macro-limbic circadian prefrontal cortex and amygdala and hippocampus. So antidepressant medications, they have different types, but the SSRIs are a type of antidepressant medication that selectively block serotonin transmitter. If you want to know, serotonin is a neurotransmitter, and this neurotransmitter, they block that neurotransmitter transfer. That prevents reuptake of serotonin back into the presynaptic neuron. This increases serotonin availability in the synaptic cleft, especially in the cortico-limbic circadian. It is the frontal cortex. In the frontal cortex, hippocampus, and amygdala. So those areas, this medication increase the availability of a serotonin in these areas. The clinical effect is not immediate because both the synaptic receptors initiate downregulate and sensate over 2 weeks. So that you will not feel, when you take the SSRI medication, you will not feel the effects quickly, because it will take 2 weeks to 6 weeks. And the reason being, both the synaptic receptors, they move this chemical transport. They initially downgrade and desensitize over. So that work takes 2 weeks to 6 weeks. The therapeutic effect reflects neuroadaptation and circuit recalibration. So it will recalibrate, it will correct and adapt to the neurons, not just increase the serotonin, but it will help the neuroadaptation. It will help the recalibration of the neuron signals. So this medication will help with that. And that work takes 2 weeks to 6 weeks to take effect. you will see the therapeutic effect within that period, 2 weeks to 6 weeks. The key side effect of SSRIs are GI upset. GI upset, what I mean is diarrhea, nausea, increase mortality, motility. So serotonin receptors are abandoned in the gut. So serotonin receptors are more in our stomach. That leads to increased GI symptoms such as nausea, vomiting, dehydration, diarrhea, motility. And also SSRIs, they lead to sexual dysfunction because serotonin inhibits dopamine pathways in the muscle limbic reward circadian. That lowers the libido and organism. So because the serotonin inhibits the dopamine pathway, that affects sexual desire and it causes sexual dysfunction. Activation of anxiety earlier, they also cause anxiety, and that initial serotonin overstimulation. Because this medication, they increase the availability of a serotonin, that initial serotonin increase, overstimulation increase the limbic arousal before the receptors adapt to it. So this adaptation and the stimuli increases anxiety. Those are some of the side effects of the SSRIs. It also, other symptoms include hyponatremia or SAD, SIADH. So serotonin stimulates ADH release, which is hormone, and that increases water retention. This water retention lowers the sodium. Other symptoms is serotonin syndrome, excessive serotonic tone across the nervous system, central nervous system and peripheral nervous system, neuromuscular contraction, automatic aromatic toxicity. So other side effects include serotonin syndrome, which is the excessive serotonic tonic across the nervous system in the neuromuscular contraction. That means it will causes muscle issue, rigidity, and something in that area. Some of the SSRI medications, I'm going to write down in the description area, but it includes Zoloft, it includes fluoxetine, and it is escitalopram. Those are some SSRIs. They mostly end with lean or exatine, like fluoxetine. So if you want to study the medication, you want to study their suffix. Contraindication of SSRIs are overlapping with MAOI. MAOI is the other medication because both of them, they increase the serotonin, and that leads to life-threatening serotonin syndrome. Also, if the patient has a bipolar disorder, that increases the serotonin more and can mask dopamine activity and manic switch. It will increase the manic syndrome of a bipolar person if you give them SSRIs. It's also contraindicated taken with NSAIDs and anti-convulsion medication. Serotonin normally supports platelet aggregation, and that increases bleeding risk when depleted. So don't take SSI, don't take with Tylenol category, and as NSAIDs and anticonvulsion, anticoagulant. So don't take with like heparin or SSR medication, because all of those medications will increase the risk of a bleeding. So those are some of the side effects. Some of the side effects and contraindication. So SSRIs, don't take them with MAOIs. Don't give SSRIs patient with bipolar disorder. Also, it's contraindicated to take SSRIs with NSAIDs or anticoagulant blood thinner medications. Blood thinner medication is contraindicated with SSRIs. Next, we want to talk about SNRIs. SNRIs examples are venlafaxine and duloxetine. Venlafaxine and duloxetine are example of SNRIs. Mechanism of SNRIs include they block both serotonin and norepinephrine, and they increase serotonin and norepinephrine in the descending brain pathways and mood circuits. This dual effect makes them a special useful in a pain and depression comorbidities. So if the patient have pain and if they have depression, they can take an SNRIs like the fluoxetine or fluoxetine. Side effects of SNRIs include hypertension, which is dose dependent. It will increase the blood pressure. Norepinephrine increases the peripheral vascular tone, so it increases a contraction of the peripheral vascular tone. That increases the blood pressure, so it's one of the side effects. It is also increase the sweat and tachycardia. That is a sympathetic overactivation. They cause sympathetic overactivation, and they increase the contraction of the peripheral tone. When they increase the vascular tone, it causes hypertension. When sympathetic nervous system overactivation will lead to sweat and heart palpitation, tachycardia. Withdrawal syndrome, fluoxetine causes withdrawal syndrome, which is short-lived, but is a rapid neurotransmitter drop. Rounding dysregulation, brain zap. It's brain zap. You will feel brain zap, which is the short lifetime of rapid neurotransmitter drop, round dysregulation. Also, they can cause insomnia, increase neuroenergetic arousal that causes the insomnia. So SNRIs, they increase the blood pressure, they increase the heart rate, they have withdrawal symptoms, they also causes insomnia. Also caution if the patient have uncontrolled hypertension, norepinephrine can worsen the side effects of the vascular resistance. If the patient already have uncontrolled hypertension, these medications can worsen that hypertension. If the patient have liver disease, duloxetine can worsen that and can increase the accumulation risk because it worsens liver metabolism. Duloxetine is metabolized in the liver, so it can worsen the accumulation risk. Also, if the patient is taking MAOI, which is type of medication, don't take same time because it can increase both of them can increase the serotonin and norepinephrine, and that leads to toxicity risk. Next, we want to talk about ACTA category of antidepressant medication. TCA medication is antidepressant medication. So TCA medications include amitriptyline and nortriptyline, and nortriptyline. Those are examples of TCA medications of antidepressant medication. TCA medications, they block serotonin and norepinephrine, but they also strongly block M1, H1, and beta 1. M1 is an anticholinergic, so they block anticholinergic, they cause sedation, they also cause orthostatic. Their side effects. So they block serotonin, norepinephrine. Also, they have the effect of anticholinergic. They cause sedation. They lower the blood pressure. Some of the side effects of TCA include dry mouth, urine retention, delirium because of the M1 blockade. Because they block the M1, which is anticholinergic, that increase the delirium. They also cause dry mouth and urine retention. They also cause, some of the side effects include, they cause sedation and weight gain because of the H1 blockage. They also cause low hypertension because they block beta 1. They also cause cardiac toxicity because they block sodium channel in the cardiac tissue. That leads to widen of a QRS arrhythmia, so it causes arrhythmia. So TCA medication, which is antidepressant medication, they cause dry mouth, urine retention, delirium, which is confusion. They also cause sedation, weight gain. They lower the blood pressure. They cause cardiotoxicity, which causes the arrhythmia. Heart palpitation can lead to heart failure. So those are some of the side effects. What to caution about or high. You wanted also caution about overdose risks. They also cause overdose risks. And overdose risks, they have a narrow therapeutic index. They have a narrow therapeutic index, means if you increase the dose more than they should, that can cause toxicity. Also, you want to be cautious about cardiac disease conditions. If the patient have a cardiac condition, you don't want to prescribe this medication. They also cause glaucoma. They also worsen glaucoma and PBH because the anticholinergic worsening the urine retention and intraocular pressure that worsens glaucoma and urine retention because it increases the contraction of the PBH. It makes it worse. Next, we want to explain MAOIs, antidepressant medication. And some of the medication is for the MAOIs include Nardel also have other, this is one of the medication, Nardel or phenelzine. Other medications of MA include Bernate and so this medication, I'm going to write them in the description area. The two examples of two medications of MAOIs. So the mechanism of MAOIs, they inhibit serotonin and norepinephrine and also dopamine. Prevent breakdown in a higher monoamine accumulation that causes high monoamine accumulation because they inhibit the serotonin, norepinephrine, and dopamine that will increase the high monoamine accumulation. That's what they cause. So what are the side effects of MAOIs? MAOI side effects are hypersensitivity, hypertension crisis. They call hypertension crisis, thiamine not metabolized. If the thiamine not metabolized, that leads to massive norepinephrine release, and that causes hypertension crisis. So some of the side effects is hypertension crisis if you take with food that contain monoamine, because it's already have more, it's causing more monoamine accumulation. If you take this medication, it will increase, and thiamine is not metabolized, so that will lead to massive neuroperipheral release, massive neuroperipheral release that causes hypertension crisis. Also, it can cause serotonin syndrome if combined with SSRIs or SNRIs. So if you combine other antidepressant medications, it can worsen serotonin syndrome and it can cause that. Also, it causes insomnia because it stimulates the central nervous system. So if the patient is taking MAOIs, you don't want to combine that with other antidepressant medications. What to caution about? You want to be caution about thiamine foods, include eggs, cheese, and wine. Aged cheese that is aged, and wine. You don't want to take that because they have thiamine foods, and that will lead to hypertension crisis. You want to maintain washout period. Washout period, what I mean is there has to be gap. It will take us 14 days to clear from your body, this medication to clear from your body. So you don't want to take 14 days, you don't want to take aged cheese, wine, or other medications like the SSRIs or SNRIs. There has to be 14 days between them, 14 days after or 14 days before that. So it can wash out from your body. It's called washout periods. Sympathetic mimicking, it has a pseudoephedrine dangerous. So those are the what to caution about. Don't take food that has thiamine foods. You have to take 14 days between these medications before you take other antidepressant medication or eat cheese or take wine, as we talk about. Next, I want to talk about and explain antipsychiatric medications. Antipsychiatric medications, we want to begin the first generation antipsychiatric medication, and that include Haldol and chlorpromazine. Haldol, they are example. There is other medication in this category, but for example of those ones include Haldol and chlorpromazine. First generation antipsychiatric medications, they block D2. They are strongly D2 blockers in the muscarinic pathway that reduces dopamine, driving positive symptoms. There is a negative symptom and positive symptoms of psychosis. So psychosis has a negative and positive symptoms. Psychosis positive symptoms include hallucination, delusion, disorganized status and behavior. This medication which is the first generation antipsychotic medication, like the Haldol, like the chlorpromazine, they improve this hallucination. They treat the hallucination, delusion, and disorganized status, which is the positive symptoms of a psychosis. They treat those by blocking the dopamine, reducing the dopamine. But they block dopamine also in the neuroadaptation, which is the movement, which causes the movement. And they also block the dopamine in the taburoinfundibular. That block is prolactin. So they affected the movement, they affected the prolactin, they treat positive symptoms of psychosis. Haldol, mostly how I saw it, if the patient agitated, which is the positive symptoms of psychosis. If they are agitated, if they are aggression, if they are scared and worried, and they are hypervigilant, it calms them down. So Haldol and cobramazine, that is how I seen in the hospital being used. Some of the side effects of this medication are EBS in the nigrostriatal dopamine blocker. EBS is caused by that there is an area called nigrostriatal. They block the dopamine in that area, and that affected the motor. That leads to motor dysfunction. So it will have a shuffling gait. It will have EBS. It is muscle rigidity symptoms. They also can cause tardive dyskinesia. Tardive dyskinesia is a movement, abnormal movement, that caused by the dopamine receptor blocker, and that is the long-term use. They also can cause, those are the side effects, they also can cause hyperprolactinemia, because dopamine was blocked in the tuberointerfundibular, that increases the prolactin. They also cause NMS, severe, if there is a severe dopamine blocker, that can lead to muscle rigidity and hypertonic and muscle rigidity. So you want to be cautious about these symptoms. You want to caution if the patient have a Parkinson's disease, you don't want to give them this medication because the patient of Parkinson's disease causes dopamine. It's caused by the low dopamine of the brain. Low dopamine of the brain causes Parkinson or pseudo-Parkinsonian symptoms. So if the patient is already having those symptoms or Parkinson's disease, you don't want to prescribe this medication, first generation antipsychotic medication, because it will worsen that. Also, Haldol can cause QT prolongation, especially IV Haldol. IV Haldol can cause arrhythmia. It can cause arrhythmia by QT prolongation. Also, patients who have a dementia patient, it can increase the mortality risk because it will increase the stroke and infection. These medications, they increase the stroke because of the QT prolongation, and they can increase infection risk. So you don't want to give this medication patient who have a Parkinson, patient who have cardiac issue, patient who have a dementia. You have to be careful giving this medication or prescribing this medication to that patient. Next, we want to explain second generation antipsychotic medication. So the first generation is the preferable. However, depending on these side effects that we talk about, second generation antipsychotic, they block dopamine moderately. So second generation is more favorable than first generation because they block dopamine partially. They cause less EBS symptoms. They block dopamine and serotonin. So serotonin blockage feeds up dopamine in a neuroadaptation pathway that causes few EBS. So they still cause the EBS symptoms and muscle rigidity, but they are less than first generation antipsychotic medication. Some of the side effects of a second generation antipsychotic medications include metabolic syndrome because of the H1 and serotonin blockage. They block this medication, they block H1 and they also block serotonin. So that leads to appetite dysfunction, hypothalamus, in the hypothalamus. So they increase the weight, they increase the appetite, that increase the weight, that increase the diabetic, that because they cause H1 blocker and serotonin blocker together, increases the appetite, increases the dysregulation in the hypothalamus. So they affect in the hypothalamus. They also cause sedation by blocking H1. So that increases diabetic because it leads to insulin resistant and appetite stimulation. So it causes weight gain. Raspadol, which is one of the second generation medication, causes prolactin elevation because it is a strong blocker of a dopamine affecting in the tuberointerfundibular pathway. So the cause symptom is same as the first generation, but it's not stronger. It's not, so it's less. That's why they are preferable. Klonopin, which is one of these colosabine, which is the second generation antipsychotic medication, is a weak dopamine blocker and a strong serotonin blocker, multiple receptor affected. Messy but powerful drug. This is messy but powerful drug. So side effects of colosabine include ammonia-mediated bone marrow suppression. It causes the bone suppression. So it will lower your immune system. It can lead to seizure. It will lower the seizure threshold, which is dose dependent, but it has that side effects. It also can lead to myocardial inflammation. It can lead to constipation because it blocks because it causes anticholinergic in the stomach. That will cause the hypomotility, and that can cause viral illnesses. So it can lower the motility that causes the constipation. So colosabine can cause low immune system because it suppresses the immune system, bone marrow suppression. It can cause seizure. It can cause cardiac, which is the heart muscle inflammation, and it can lead to constipation. Next, we wanted go over the mood stabilizer. First mood stabilizer is the lithium. Lithium is a modern secondary messenger system. It stabilizes intracellular signals and increases neuroplasticity. It stabilizes the mood. Mostly maniac is the first line of treatment for mania. Some of the side effects of the lithium include tremors, nephrogenic ID, hypothyroidism, and toxicity. Tremors because it affects cerebral neurological effect. It has a neurological effect. It causes also nephrogenic ID because the ADH responds in a collection duct. It affects the collecting ducts of the kidneys. Also, it has a narrow therapeutic window that causes accumulation effect in the nervous system that leads to toxicity. So you want to be cautious giving this medication to NSAIDs. Don't give this lithium with NSAID medication. Don't give lithium with ACE inhibitor, which is cardiac medication, or thiazine medication because they reduce lithium clearance. And if they reduce lithium clearance, that will cause toxicity because it will build up in the body. The body is not clearing the lithium, so that causes accumulation and that leads to toxicity. Caution about the dehydration because dehydration reabsorption increases the reabsorption of the lithium. Also, you want to be cautious. You want to encourage the patient to drink more water, moderate water, because dehydration causes the increased reabsorption of lithium and that increases the toxicity. You want to also caution about pregnant women because lithium affects fetal cardiac malformation risk. It has a malformation risk. Abstain anomaly. It can lead to abstain anomaly. So those are the lithium side effects. Now we want to go to valproate. Valproate is a mood stabilizer. It increases the GABA availability and it lowers the sodium channel firing. That decreases the neuroexcitability. That calms the patient and decreases the neuroexcitability. However, what are the side effects of the valproate? Valproate side effects include liver toxicity, pancreatic inflammation, therapeutic that affects fetus, neurotube defect. It can lead to neurotube defect. So it also causes weight gain. So valproate increases the GABA availability, lowers the sodium firing, decreases the irritability, and it causes liver toxicity, pancreatic inflammation. It can affect the fetus and cause neurotube defect that relate to folate interference. It will interfere the folate. It also causes weight gain because it has a metabolic dysregulation. Next, we want to talk about lamotrigine. Lamotrigine is a mood stabilizer and it decreases glutamate release. That stabilizes the mood and lowers the excitatory signals. Side effects of lamotrigine include skin irritation, Stevens-Johnson syndrome, which is ammonia-mediated rash due to rapid titration that requires slow titration to prevent immune activation. So you want to educate the patient to report if they have a skin rash, skin irritation, any skin issue. You wanted them to report that. All the symptoms that we went over, you want to educate the patient. If you see these symptoms, come back and let us either adjust the medication or change the medication. Next, we want to explain the benzodiazepine. Benzodiazepine enhances GABA receptors frequency of a chloride channel opening, and that increases that leads to hypopolarization of the central nervous system inhibition. It will inhibit the nervous system firing. That leads to sedation and global nervous system inhibition. It causes sedation. Those are some of the side effects of a benzodiazepine. It causes sedation, it causes dependency, it causes respiratory depression that can cause sometimes, if it's overdose, it can lead to overdose. If used over the prescribed dose, it can lead to death. So it leads sedation, it leads dependency and addiction. It can lead to addiction. It leads respiratory depression, especially if you take with alcohol and opioids. It leads to fall in an elderly patients because the motor and it lowers the motor and cognition. So if make you weak and tired and vaggy, that will lead to falls, especially the older adult. Next, we want to explain stimulants. Stimulant like my amphetamine, amphetamine, and methylphenidate. They increase dopamine release and they lower the reuptake. Side effects of this stimulant are insomnia because they increase the cortical arousal. They suppress the appetite in the hypothalamus dopamine effect. They also cause heart palpitation in the synaptic activation. They can also lead abuse potential. It has abuse potential because of the muscle-limbic dopamine reward pathway stimulant. In the hospital, I have seen people who come to the hospital and they wanted the doctor to prescribe these medications. They have been addicted to it, and they come to the hospital and they will insist that the doctor has to prescribe this medication for them. I need my medication. I cannot be without this medication. And the doctor will tell them, I'm going to prescribe different medications. You have been taking this medication. You don't need this medication. You are not at work. You don't need to be stimulated. So you need to sleep. You need to take different medication, but I'm not going to prescribe. And they will be very upset about that. This doctor, he don't know what he's doing. He is not. I don't need this kind of doctor. They will be so upset because they are addicted to it. They want to be high all the time. They want it. So it's not, it has that abuse potential because of the reward, dopamine reward in the muscle limbic pathway stimulation. They want to be have that feeling. They want to feel that feeling. Next, we want to talk about, so you want to assess that when you are prescribing those, you want to assess if this patient has this potential. You want to assess that follow appointment if they having any symptoms of that, or if they are requesting that you prescribe this medication. Those could be the signs of abuse potential. Next, we want to explain atomoxetine. This medication is a SSRI medication, and other name is Stararia. Stararia is a medication for ADHD. Stararia is most widely recognized, and it has a fast effect. It's a SNRI. So it blocks serotonin, norepinephrine reuptake, and it's not a stimulant. Unlike the other traditional stimulant of ADHD medications, this one is not a stimulant. It's SNRI's medication. Stardate. That's the other name, or atomoxetine atomoxetine. So mechanism of this medication is improves prefrontal cortex signal to noise ratio because it inhibits norepinephrine reuptake. Selective norepinephrine reuptake inhibitor that leads to improved prefrontal cortex signal to noise ratio. Side effects of this medication include GI upset, SI, especially for children, suicidal ideation for the children, and liver damage. It can lead to liver damage. Thank you for joining me today. Please subscribe and join me in my next video. Thank you.